How has spinal bracing for osteoporosis fractures evolved? Spinal bracing for osteoporosis-related fractures has come a long way over the years. It started as a common way to help manage pain and support the spine after a fracture, especially in older adults. The idea was that a brace could immobilize the affected area, reduce movement, and prevent the fracture from worsening or deforming further. Back then, braces were often used routinely, but there wasn't always strong evidence to support their long-term benefits. Many patients found braces uncomfortable and restrictive, which made compliance difficult. Plus, early research showed that while braces could help with pain relief, they didn't really reverse the spinal deformity or stop the progression of kyphosis, the forward rounding of the back caused by vertebral collapse. As more studies were conducted, the understanding of bracing's role became clearer. It became evident that bracing can be helpful in reducing immediate pain and muscle spasms, but it isn't a cure. It doesn't fix the fractured vertebra or prevent future fractures. Today, medical guidelines recommend using braces selectively, mainly for patients who experience severe pain that limits mobility or are at risk of developing more deformity. The focus has shifted toward early mobilization, which helps prevent complications like muscle weakness and further bone loss. It's also recognized that treating the underlying osteoporosis is essential, often with medications like bisphosphonates, along with lifestyle changes such as diet and exercise. In recent years, minimally invasive procedures like vertebroplasty and kyphoplasty have gained popularity. These involve injecting bone cement into the fractured vertebra to stabilize it and relieving pain, especially when conservative measures like bracing don't work. These procedures are usually reserved for cases with persistent, severe pain. Their role is still being studied, and ongoing research aims to better understand their long-term benefits and risks. Newer techniques, such as vertebral body stenting and the KIVA system, are also being developed to improve outcomes and reduce complications, but high-quality evidence is still emerging. In current osteoporosis care, the approach is very personalized. Bracing might be used temporarily to help with pain and support, but it's not a long-term solution. The main goal is to strengthen bones through medication and lifestyle changes to prevent future fractures. Patients should work closely with healthcare providers to decide the best combination of treatments, which may include bracing, medications, physical therapy, or even surgical options if needed. The evolution of spinal bracing reflects a broader shift toward evidence-based, patient-centered care that emphasizes early mobilization, osteoporosis management, and minimally invasive procedures when appropriate. Always consult a healthcare professional for advice tailored to your specific situation, as individual needs can vary widely.